Another common question I get at meet and greets is why I called this Homestead. What makes my direct primary care different than any other direct primary care? Because that's what's nice about having every doctor own their own practice or small groups of practices is that you really get to see the personality and what's important to that doctor expressed through their clinic. There's an expression that if you've seen one DPC, you've seen one DPC, that each of them is so different. So personally, I have 5 acres and a bunch of animals and a big garden because that's what I enjoy doing in my free time. And so it's kind of a homestead that I live on, and there's a movement in modern homesteaders to not only be creating food for their families right now, but also to be working to heal the ground, to heal the animals from damage we've done in the past, from things that we didn't realize were causing damage. So putting all the compost, the 50 bags of compost that I get from my cow every day, back into my gardens or just back into the field to get more of that topsoil, to help that soil absorb water more and help prevent flooding, things like that. And it's small. It's just my little 5 acres. It's not going to change the world, but that's also what I can do. I see very similar goals in medical care. I not only want to provide care for your wart today, but I also want to work with you and have a relationship with you to heal whatever past damage was done, whether that's from other doctors that didn't really listen to you or rushed you through the appointment, or from people telling you that the number of calories that you take in directly correlates with what your weight is. So if you would just cut down on those calories, you would lose all that weight. We just have better understanding of things now, and having that relationship with my property, with my animals, and with my patients. Not that I want to equate you to at all, but I see some similarities there, and that's part of why I named this practice Homestead Direct Primary Care.